Well wishes are pouring in for former President Joe Biden after his office revealed the former president has been diagnosed with an aggressive form of prostate cancer. Among leaders chiming in, President Trump posted on Truth Social wishing the 82-year-old a speedy recovery. Biden publicly commented on the diagnosis on X, saying in part, quote, "We are strongest in the broken places." The CDC says prostate cancer is one of the leading causes of death among U.S. men. Joining us now to break this all down is Dr. Keith Kowalczyk, chair of the Department of Urology at MedStar Georgetown University Hospital right here in the nation's capital. Doctor, thanks for joining us. We know the former president's office has described his case as an aggressive form of prostate cancer. Is this form of cancer typically caught before it gets to be this severe?
It typically is. For most patients, it's caught at a very, very early stage with PSA screening at younger ages, which is a blood test that men get, especially high-risk men get, to hopefully find prostate cancer before it gets to this stage and this grade. But unfortunately, we do see cases like this, so this is not uncommon.
We also heard that the cancer has metastasized to the bone. However, it is hormone sensitive. Doctor, can you explain what that all means?
Yeah, so President Biden has the highest grade of cancer that there can be, which means it's very, very aggressive. So it's not uncommon to see that the cancer has spread beyond the prostate, normally to bone or to lymph nodes. So it has spread beyond the prostate is essentially what it means when it went to bone. Key factor here is we don't know how much it has spread to bone. Sometimes it's just one spot, sometimes it's multiple spots. But the key here is that he'll need what's called systemic therapy. We're not really looking at surgery or radiation to cure this disease. We're looking at treatments that can control it. And that's with what we call hormonal therapies that control testosterone levels. Prostate cancer needs testosterone to grow. So when it's hormone sensitive, that's generally when it's first being treated. That means that it should be very, very treatable at this stage and hopefully for a long period of time.
Given your expertise in this field, doctor, how soon do you start looking for warning signs of this type of cancer, especially in elderly patients?
It's real difficult, especially in elderly patients, as you said. So we recommend screening for at-risk patients. So if you have a brother or a father, Black patient, if you have a history of BRCA2 gene, which is most commonly known for breast cancer and ovarian cancer, but actually those men are at higher risk for prostate cancer. We recommend starting screening or asking your primary care physician at about 45. For the rest of the general population, between 55 and 69 is when most men are diagnosed with a curable form of prostate cancer. So that's where we really focus our screening. If patients get beyond 69 into their 70s and they haven't had any of these risk factors, they haven't had a high PSA, we don't recommend routine screening. That's a conversation between the primary care physician or the urologist, the physician, and the patient. So with President Biden, I think being about 82 years old, that's not a patient that we would be screening for prostate cancer in most cases because it, quite frankly, is usually not lethal at those ages. And there's usually a lot of what we call competing risks. There's other health problems that are more threatening to patients that are older than prostate cancer. And it's a tightrope that we have to walk. You can still check it every once in a while, but sometimes it leads you down a rabbit hole you don't want to go down. And sometimes, you do have cases like this. But the good news is it should be very, very treatable, at least at this stage.
Well, we're so grateful for your expertise as we all just join in prayer for our former president, Dr. Kowalczyk. Thank you.
Thank you.